In the last 1 week, I've had 4 doctors doing one-on-one interview sessions with me. Now, most of the shortlistings in my experience come in batches. Last week, it had been a turn of South Australia, Adelaide Hospital Network and Blacktown Hospital in Sydney. And as for the good and not so good, the portion of doctors that do one-on-one interview with me, so I am only catching the tip of the iceberg, and there might be many doctors who are shortlisted elsewhere and obviously they've not contacted me. Now, as I said before, this is the second round of job interviews, and I'm glad to see that doctors with huge career gaps are also getting shortlisted. Some have got the career gaps of 7 years or more. But the only difference is now that they're actually doing recency. They're actually gone back home and doing recency requirement, clinical experience in acute medicine and emergency medicine, doing all those ALS, BLS and procedural skill courses. And it really makes a huge difference when you're making these sacrifices despite having young kids and family. Now, the important bit that I want to talk about is interview technique. The interview technique for most IMGs is leaving still a lot to desire. I would like to give you top 3 reasons why I think these shortlisting don't end up being job offers. Firstly, interviews mean that you stand a good, in fact, excellent chance of being offered a job. So practice these interviews very, very well. When I conduct one-on-one sessions, I see medical terminology being misused, words being used out of context. I'll give an example. During a clinical scenario questions, 90% of the doctors would say, I would do DRABCD protocol. Now, there is no such thing as DRABCD protocol. There might be some non-medical personnel during the interview from medical staffing. They may not understand that terminology. So use the actual word, use the details. Given the critical condition of my patient, I will assess and manage the airway to correct the hypoxemia, aiming the saturation of above 95%. Also, I've heard terminologies like I'll hook my patient up to the monitor. Again, a very bad choice of words. Hooking patient to anything is not a good idea. In fact, the better choice of words would be I would closely monitor the vitals of my patient with 12-lead ECG monitoring and non-invasive blood pressure cycling every 2.5 minutes to keep a close and watchful eye on his vitals. Now, why these correct terminologies are important? Because they show that you have worked in a comparable health system. And even if you've not worked in a comparable health system, you've actually made efforts to learn about an Australian health system. Plus, on top of that, you have communicated these terminologies looking after unwell or sick patients. Yes, that is your experience in words. Secondly, people leave right until the very end when they get called about the shortlisting to contact me to do one-on-one interview. Now, some of the people would get notice like 1 day or 2 days at max, and then I have to refuse them. And I must say that with a very heavy heart, I've actually turned down 3 or 4 one-on-one interview requests because I was working, I had no time. And I can understand that you might like to leave and keep your one-on-one interview session with me for the very last so that you're fresh and well prepared. But then again, the job market is very competitive and you need to be well prepared. And if it's your first job in Australia, you must do very good practice for that one interview that may not come again for a good amount of time. So once you start applying for jobs, please book an appointment with me if you want to do one-on-one session with me so I can prioritize and do a proper session with you. Now, as most of you know, I record a video of you for you only and I send that video out to you so you can review your own performance. Plus, I do a detailed feedback along with a personalized report which I email. And that report is based on your performance, what has gone well, and what can be improved further. So there's a lot of feedback and appraisal in that one-on-one session that could really incorporate in that interview practice session and improve your chances of getting a job. Now, I'll give you an example. When I did my first consultant job interview for emergency medicine at Campbelltown Hospital ED, I was not successful. And the director who was conducting the interview said, I've got a big regard for him. He's a very senior and very seasoned emergency physician. He said that, Rizwan, interviews are like OSCEs and Vivas. We are looking for very specific responses to the question asked. And if you're not giving us those answers, you're not going to score a right or correct amount of numbers to end up having a job offer. And I think that was the best piece of advice given out to me. And that really helped me improve my technique, my answer, to finally land myself 2 consultant jobs in one of the best hospitals that I'm currently working in. Now, for IMGs, interviews are also like mini OSCEs and perhaps more scrutinized, as they are, they've not worked in the system, and people who are trying to give them job, they want to make sure absolutely 100% that these are the right doctors for their department, because they have not practiced in Australia, and they want to make sure that they're safe and they're ticking all the boxes when it comes to the questions and their answers. Lastly, I'd like to talk a little bit about clinical governance question. Now, clinical governance questions are no longer about standard definition. The question about governance, conflict, complaints, it's not just giving a box standard definition. It's more about how do you practice clinical governance on daily basis in your own medical practice? How would you handle a complaint, and give us an example of what you learned from a complaint? How would you openly disclose a patient about some mishap that has happened or clinical incident that has happened? Give us an example. So there are very personalized experiences which are being extracted from the candidate, and I can call them discriminator question. So these are the questions which separate the wheat from the chaff, that if you perform well in these questions, you almost certainly will stand out from the rest of the crowd and end up having a job. So really good performance in this question is that top 10% of the candidates. So when I ask a question on clinical governance, the IMG would say, sorry, I'm not sure. This is not a correct response. The governance, when I rephrase it, they say governance is about patient safety, risk management, and improving quality of care that I deliver to my patient. And in my routine practice, thorough clinical prioritization, thorough handover, and safe prescription techniques is what I practice on every day. And this is a beautiful answer. But then again, you need to have an even more specific example from your work practice. And trust me, some of the IMGs, when I've dug into their CV and application forms and probed them into it, they've come up with some of the most beautiful clinical governance example, which I could not even imagine in an Australian health system. So you have got a wealth of experience. It's just that it needs to be extracted out. At the end, I like to say practice. Once you're filling the application forms, please make a booking with me if you want to stand a good chance of being landed a job offer. You may choose not to, and that's entirely your prerogative, but if you want to practice with me, because you may only get 24 or 40 hours of notice after being shortlisted. So instead of panicking, make sure that you're ready and you're smiling because you're well prepared. At the end, I'd like to say, here's wishing you the very best of luck, provided you worked hard for it. It is the end in sight, and hope you make the best out of it. Good luck.